This episode is adapted from a clinician-written article on Mentalyc and brought to life in audio for therapists who prefer listening on the go.
Yeah, so if you're driving between sessions, finishing notes at 9 p.m., or just walking your dog and trying to reclaim your brain, this one's for you.
The piece we're drawing from today was written by Dr. Salwa Zainadine, a medical professional and mental health advocate, and we're really glad to be sharing her perspective with you.
And since the article comes from Mentalyc, it helps to say up front, this is a clinical intelligence platform built to support therapists with documentation, not replace your judgment or your voice.
Okay, so let's drop into the real world for a second.
Yeah, picture this. It's Thursday night, you just wrapped your last session, your eyes are fried, and you're staring at a blank progress note thinking, how do I prove this was medically necessary without writing a novel?
Or it's that moment when you get the email subject line you dread, request for records or documentation review.
Your stomach drops a little. Not because you did anything wrong, but because you're wondering, did I make the golden thread clear enough? Will they see what I see clinically?
And underneath that is an even more human fear. If this gets denied, does it look like I didn't actually help my client? Did I miss something?
Exactly. That's really where this article lands, on that intersection between good clinical work and defensible, clear documentation of medical necessity in mental health.
So maybe we start with the thing no one really taught us well in grad school. What medical necessity actually means in a way that feels usable in our notes, not just in policy documents.
Yeah. The way Dr. Zainadine frames it is simple and very grounded. Medical necessity basically means this service is required to diagnose, manage, or improve a specific mental health condition.
Not just because the client likes coming in, or because it feels supportive, or because it's convenient.
Right. Insurers are basically asking, is there a diagnosable condition? Is there clinically significant distress or impairment? And is what you're doing in session directly targeting that in a goal-directed way?
And that's the key insight I want us to sit with today. Medical necessity lives in the link between symptoms, diagnosis, functional impairment, goals, and what you actually did in the room.
That's the golden thread the article keeps coming back to. If that thread is visible in your progress notes, you're not just compliant, you're also telling the true clinical story of why this client needs ongoing care.
And this is where Mentalyc shows up in a really practical way. It's positioned as a clinical intelligence platform that helps you actually map out that golden thread: symptoms, diagnosis, interventions, and measurable progress, without you having to manually reconstruct it at 10 p.m.
Which is when most of us are trying to reconstruct it.
Exactly.
Let's ground this in a scenario. Say you have a client with major depressive disorder. They're not just sad, they're missing work, struggling to get out of bed, stopped cooking for themselves, and they're isolating socially.
In the room, you're doing solid clinical work. Maybe you're using CBT, cognitive restructuring, behavioral activation. You're tracking mood. You're challenging core beliefs like, I'm a failure, nothing will change.
But in the note, it's easy to write something like, processed mood, provided support. Client reports feeling slightly better.
Which we've all done.
Yeah. And the problem is, from an insurance or audit perspective, that doesn't prove medical necessity. It doesn't show what diagnoses, what impairment, what evidence-based intervention, what measurable change over time.
So one of the key moves the article suggests is don't just document symptoms in isolation. Document how they impact functioning in very real, concrete ways.
For that same client, instead of client is depressed, you might write client meets DSM-5 criteria for major depressive disorder, moderate. Depressive symptoms, low energy, anhedonia, impaired concentration are causing difficulty maintaining employment. Client has missed 5 workdays in the past month and reports declining performance reviews.
Now, when you pair that with a goal like client will reduce missed workdays from 5 per month to no more than 1 per month over the next 8 weeks, you've created something we can actually track.
And then your intervention line, used cognitive restructuring to challenge all-or-nothing thoughts about work performance, assigned behavioral activation task of 2 scheduled workdays with pre-planned coping strategies, suddenly sits inside a clear medical necessity frame.
That's the golden thread. Diagnosis, impairment, goal, intervention, progress.
And this is where Mentalyc comes in as more than just a note generator. The platform is built to help you capture that full arc automatically, presenting symptoms, functional impact, clinical interventions, and progress, so your notes naturally reflect medical necessity without you having to constantly think in insurance language.
And I really appreciate that in the article, they're explicit. It's not about replacing your clinical voice. It's about making documentation lighter while still keeping your style and your judgment at the center.
Yeah, it's more like scaffolding for the parts of our brain that are tired at the end of the day.
Let's pause for a second on the emotional layer of this, because documenting medical necessity isn't just a technical task. It hits our identity as therapists.
When a claim is denied or an audit questions your documentation, it can feel like they're questioning whether your client deserved care or whether you're actually effective.
And that can stir up shame, defensiveness, or just exhaustion, especially when you know you're doing deep, meaningful work in the room, but the paper trail doesn't fully show it.
Dr. Zenadine really names that tension. Documenting medical necessity is essential for ethical and financial reasons, but it's also one of the most time-consuming, draining parts of practice.
And yet, when we do it well, it protects our clients' access to care, supports reimbursement so they can stay, and protects us, our licenses, our reputations, our ability to keep the doors open.
So the invitation here isn't become a perfect insurance scribe. It's more, let your notes tell the truth of your work in a way that stands up in an audit.
Exactly. The article highlights functional areas like work, school, relationships, self-care, daily responsibilities. Even if it doesn't list them one by one, that's the idea. Document those impacts. Clients' panic attacks prevent them from driving to work. Clients' trauma symptoms lead to avoidance of intimate relationships, that sort of thing.
And then each progress note becomes a small answer to the question, why is continued treatment still medically necessary today?
So you might write, although client reports decreased intensity of depressive episodes, they continue to experience impaired concentration at work, requiring ongoing CBT to consolidate gains and prevent relapse.
That's clinical reasoning on the page.
And this is where tools like progress tracking inside Mentalyc become really clinically relevant. Because if the platform is automatically reflecting measurable changes over time, like fewer missed workdays, reduced panic frequency, improved sleep, you're not starting from scratch each session trying to remember, wait, how bad was it 4 weeks ago?
Yeah, the mental spreadsheet we all pretend is sustainable.
Exactly.
All right, quick pause here.
If everything we're talking about, audits, golden thread, defending your notes, feels familiar in your body, this is where Mentalyc can actually lighten the load a bit. Its AI-powered note and progress tracking features are designed to support your documentation and clinical reasoning while staying fully HIPAA and SOC 2 Type 2 compliant. You can check it out at Mentalyc.com whenever you're ready.
No pressure. Just a resource if you're tired of documentation eating your evenings. So let's circle back to that meaningful insight you mentioned earlier. That medical necessity lives in the link. Yeah, if you take nothing else from this episode, it's this. Don't let your notes float in fragments. Every note should quietly answer, what's the diagnosis? How is it impairing function? What's the goal? What did I do today that directly served that goal? And what changed, even a little?
And when you write that way, something surprising happens. You're not just writing for insurance anymore. You're also creating a mirror for yourself to see your own clinical reasoning more clearly.
And that can be grounding, especially on those days where you feel like, are we even getting anywhere? The notes can show you, oh, actually, 3 weeks ago, they weren't leaving the house. Today, they went to the grocery store alone.
That's why progress notes are more than a chore. they're evidence of change. And when they're written through the lens of medical necessity, they become defensible evidence of change.
The article also touches on something really important: being able to defend your documentation in an audit or review.
That phrase, defend your documentation, can sound adversarial, but it doesn't have to be. It can mean, I can clearly articulate why this client needed care, how I provided it, and how it helped.
And part of that is knowing the basic criteria insurers tend to look for: DSM-5 diagnoses, clinically significant distress or impairment, evidence-based interventions, and documented functional improvement over time.
That's where external resources like CMS or professional associations can help you sharpen your understanding of medical necessity definitions. But day to day, it's the pattern in your notes that really tells the story.
And again, this is where having a structure, whether you build it yourself or let something like Mentalyc scaffold it for you, can make a huge difference. Because if your template or your tool is already prompting you for what's the functional impairment, which intervention did you use, how does this relate to the treatment goal, then medical necessity isn't a separate mental task. It's woven into how you document.
And I like that Mentalyc is described as automating notes, treatment plans, and progress tracking while still keeping your clinical style. That's not about turning you into a robot. It's about taking the admin out of your clinical thinking.
Also, the transfer your notes to EHR with a single click piece. That's one of those small but huge things. No more copy pasting between systems when you're already tired.
The amount of life force we've all lost to copy-paste?
Seriously.
I also want to name the safety piece the article highlights: fully HIPAA and SOC 2 Type 2 compliant. Because for a lot of us, the hesitation with any AI tool is my client's information safe? Is this going to come back to haunt me?
Yeah, and the framing here is very much, this is a secure way to keep documentation accurate and clinically defensible, not a way to outsource your ethical responsibilities.
Yeah, and the framing here is very much, this is a secure way to keep documentation accurate and clinically defensible, not a way to outsource your ethical responsibilities.
You're still the clinician. You still review, edit, decide. The tool just reduces the friction.
And I appreciate that the article comes from someone like Dr. Selwa Zanadine, who spent years in the medical and mental health space and is very attuned to therapist needs and insurance pressures. There's a lot of respect in how she talks about our work.
Yeah, you can feel that commitment to both access to care and to making our lives a little less punishing on the admin side.
All right, let's land this with something super practical. One thing you can literally do in your next note.
Here's the takeaway. In your next progress note, add one clear sentence that links today's intervention to a specific functional impairment.
That's it. Just one sentence. For example, used exposure hierarchy work today to reduce clients' avoidance of grocery stores, which has been limiting their ability to independently manage food shopping.
Or challenge perfectionistic thoughts related to work tasks to improve performance and decrease risk of job loss due to depressive symptoms.
If you do that consistently, note after note, you'll start to feel the golden thread strengthen. Not just for payers, but for you and your client. You'll both see the arc of the work more clearly.
And if you'd like some scaffolding around that, especially for the days when your brain is just done, Mentalyc's automated notes and progress tracking can help you capture medical necessity without losing your tone or your judgment.
It's there as a quiet partner in the background, structuring the story so you can stay present in the room and a little less buried in paperwork.
So as you head into your next session, maybe just hold this question. How is what I'm doing today tied to my client's functioning? And later, let your note answer that in 1 or 2 clean sentences.
That alone moves you closer to solid medical necessity documentation and a clearer picture of the change you're helping create.
Thanks for listening, and take good care of your clients and of your own nervous system this week.